Hi, Dr. Del Grosso, SF Chiropractic. Let's talk a little bit today about sciatica and a lot of questions I get concerning sciatica, because sciatica is really a broad term and some people, look at it different ways, or as soon as they get pain in the leg, they consider it sciatica. So let's answer a few of the questions. First, what is sciatica? Sciatica is an irritation is pain caused by an irritation of sciatic nerve. Sciatic nerve is probably the largest nerve in the body. It's about the size of your pinky. Okay, it's very large, travels down the back of the leg from the nerve roots in your low back, down the back of your leg to your knee. It splits off or bifurcates at the knee. True sciatica, so you know, ends at the knee. Typically, okay? If it goes past the knee, usually there's more of a lumbar root involvement or further involvement from the nerves, from the nerve roots, that branch off from the knee, okay? Excuse me. The next question I get sometimes is, can leg injury cause sciatica? Absolutely. Excuse me. Absolutely, because one of the reasons for sciatica is that the muscles in the back of the leg, your hamstring muscles, go into spasm, they tighten up and they put pressure, your gluteal muscles. When a muscle spasms, it swells, it gets larger. When you make a muscle, it gets bigger, right? It swells, they get larger, and it puts pressure on that sciatic nerve and irritates. So guess what? If you have an injury, if you hurt your leg, if those muscles go into spasm, if there's spasm in the gluteal region anywhere, that can definitely cause those muscles to tighten up, to swell, and to irritate and cause sciatic type pain, okay? Another question I get is, how long does sciatica last? Well, that's a good question, because it can last very briefly or it can last for a long period of time. Again, it's going to go back to, if the nerve becomes inflamed, how long it takes to settle the nerve down, get rid of the inflammation. How long does it take to get rid of that spasm, that hypertonicity of those muscles that's putting pressure on that sciatic nerve? And is the sciatica actually coming from the sciatic nerve itself, or, like I said, coming from up a little bit higher where the lumbar nerve roots are? If it's coming from the lumbar nerve roots, it's a little more difficult and it can take a little bit longer. True sciatica actually can resolve within 2 or 3 days if it's managed right, to do the stretches, relax things. So it's a pretty broad answer there, but yes, it can be resolved fairly quickly, or it is something that can take a while. Okay, how does chiropractic help sciatica? Well, the way we help sciatica is, one, adjusting the lower back, those things, to get the pressure off the nerve roots in case some of that's coming from the roots. And remember, if there's irritation in the nerve roots, that also causes spasm, hypertonicity, and cause those gluteal muscles to spasm and can irritate the sciatic nerve. So we can help that way. We can give you stretches that you can do to help relieve the hamstrings, the gluteal muscles and everything, to take the pressure. Stretches to get the pressure off that sciatic nerve to help eliminate the inflammation of the sciatic nerve. There's quite a few things we can do. How to treat sciatica? Well, I just kind of told you how to treat sciatica. We're going to stretch. We're going to get the muscles to relax. We're going to work to break down the inflammation, maybe a little ice in there to get rid of some of the inflammation of the sciatic nerve, some adjustments to relieve the pressure that's in there that may be causing some of the spasm and problems, and just good case management is the best way to handle sciatic pain once it's been identified. Well, epidural steroids, I've been asked, work for sciatica. Well, what does a steroid do? A steroid is an anti-inflammatory. It's basically to get rid of the inflammation. So will it help? Absolutely. The problem is if you never get rid of the source of the inflammation, then what are you going to do? You're going to take the steroid, it's going to settle things down for a little bit, but if that source is still there, if the cause is still there, as soon as the steroid wears down, guess what? The sciatica is back again, because you never really got rid of the cause, what's causing it in the first place. So my answer to that's going to be no, it doesn't. It helps temporarily, but no, it doesn't help long term. Okay? Can sciatic cause leg weakness? Well, sure it can. Not directly, indirectly, it can. Because if the nerve's inflamed, if the nerve's irritated, if there's pain there, you tend to have weakness. You tend to favor one side or the other. So absolutely, it can. Can sciatica cause weakness? Specifically, no. But indirectly, yes, it absolutely can. Exercise to help sciatica, stretching. Stretching's probably the best thing, okay? Knees to chest. Knees to chest, extend legs. Anything to kind of stretch there to get the pressure, get those hamstrings, those gluteals to relax, okay? How long does sciatica pain last? Again, we just hit this briefly earlier. It can go anywhere from 2 or 3 days if it's caught early, to months, to even longer if you never actually get to the cause and get things to settle down, what's causing that inflammation, okay? How long does it take, or how long does it take to heal sciatica? Again, as soon as you can eliminate the inflammation and the irritation of the sciatic nerve there, then you shouldn't have a problem. Now, understand one thing also, though, is that if a nerve is irritated, it goes in phases, and if a nerve is irritated long enough, over enough time where it starts to cause atrophy of that nerve, then that can be permanent, and there can be permanent problems, and that's why there is a thing called chronic sciatica, where there's permanent damage there. So yes, you can have permanent damage. Is sciatic worse in the morning? Well, it can be, and the question really is, why is it? Well, one of the reasons why is, again, if there's a lot of hypertonicity, if there's a lot of muscle spasm, those hamstrings, those gluteal muscles, and at night, what are you doing? You're sleeping, you're not moving, you're not doing everything. Those muscles tend to do what? Cramp all up, tighten up, get really, and irritate even more. Once you start moving, once you stretch, you start walking, you start doing things, it settles down a little bit, and it's not so bad. So the reason it's worse in the morning is lack of use, lack of movement. Things are tighter, things are irritating even more. Again, we said, well, exercise, actually activity, yes, anything that's going to help relax those muscles, start working those muscles and get that hypertonicity to settle down and get the use is definitely going to help. Can sciatica be caused by sitting too much? Good question. And the answer is sure. If you're sitting for a long period of time, there's not a lot of movement, muscles get tight, the nerve, you're sitting on the back of the legs, the nerve can get irritated. It certainly can cause you to have more problems. I don't think it's something that would initiate the problem, but it certainly can aggravate. Can sciatic cause numbness and pain into the feet? Good question, because sciatica itself, true sciatica, is not going to cause pain and numbness into the feet. But sciatic pain is a result of nerve root involvement. Absolutely, because that nerve root, remember, those roots in the low back are what supply the sensation and everything to the feet, to the legs, okay? And over time, absolutely, if there's enough irritation there, if it doesn't go away, if there starts to become atrophy or severe involvement, you can definitely get the tingling and the numbness and the problems in the legs and the feet as a result of sciatic type pain, but not sciatica specifically. Again, as a secondary part of it, where the involvement's coming from the nerve roots working down through the sciatic nerve, and then where they bifurcate down into the feet. I hope I answered most of your questions here with sciatica. And if you have sciatica or any more questions, please feel free to come into the office, come see us. I'm sure we can help you out with it, and we can talk some more. You have a great Memorial Day weekend. Thanks, Dr. Del Grosso.